My name is Martijn Maassen. I'm a PhD student from the Radboud University Medical Center, and today I'm here to discuss an article that will appear in the upcoming issue of Mayo Clinic Proceedings, titled Lifelong Exercise Patterns and Cardiovascular Health, a study conducted among participants of the Nijmegen exercise study. So the main objective of our study was to examine the relation between lifelong exercise patterns and cardiovascular diseases or cardiovascular risk factors during follow-up. About 21,000 people completed an online questionnaire regarding their physical activity patterns and whether they suffered from cardiovascular diseases or cardiovascular risk factors. To assess the impact of lifelong exercise patterns and cardiovascular health, we included participants aged 35 years or older and excluded participants who suffered from diabetes type 1 or failed to complete the online questionnaire. The final study population consisted of 400 persons with cardiovascular diseases, 1,400 persons with cardiovascular risk factors, and 11,000 controls. We were able to calculate an average exercise dose over a range of 32 years, and we divided the study population into non-exercisers and exercising quintiles, whereby Q1 consisted of participants with the lowest exercise dose and Q5 consisted of persons with the highest exercise dose. We found several interesting findings during our study. First, the lowest amount of exercise already yielded into significant cardiovascular benefits. The participants of Q1 reporting 300 med minutes per week had a 43% reduction in cardiovascular risk factors and a 45% reduction in cardiovascular diseases. This amount of exercise equals approximately 50% of the World Health Organization or the CDC exercise recommendations. Second, performing exercise between 800 and 1100 med minutes per week was associated with the lowest prevalence of cardiovascular diseases or cardiovascular risk factors. And this amount of exercise is equal to the national guidelines of the World Health Organization and the CDC. And the third major finding was that higher exercise dosage did not yield extra cardiovascular benefits, as we observed that the prevalence of risk factors and diseases did not further decrease. So exercise is a very powerful tool to become healthy and stay healthy. Current guidelines recommend a minimum exercise dosage of 650 med minutes per week. Our results indicate that performing exercise at 50% of these guidelines already contribute to a significant health benefit in cardiovascular diseases or risk factors. The high return on the low investment might encourage patients or vulnerable populations to start exercising and gain subsequent health benefits. We encourage physicians to report this key message to patients and motivate them to become physically active. There is, however, some recent concern whether extreme exercise training might have some deleterious effects on the cardiovascular system. In our study, the highest exercise group, Q5, which were equivalent to about 4 to 5 times the recommended exercise guidelines, still had a significantly lower prevalence of cardiovascular risk factors or cardiovascular diseases compared to non-exercisers. Our results indicate a curvilinear relation between exercise dosage and the incidence of cardiovascular diseases or cardiovascular risk factors. And with physical inactivity as the most influential risk factor for morbidity and mortality, we would recommend to keep on exercising. Well, the interaction between health benefits gained by exercise training and the detrimental effects of sitting time deserves more attention for the maximal risk reduction for cardiovascular diseases.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.